Hi, this is Morgan, the organ mover McGee. I want to tell you what I do. This is Jack's Wholeness. Imagine you played a little ball in college. You battered your body in school. You turned 35 and now you are scared of throwing out your back, stubbing your toe. You are fragile, scared of breaking. You take pills for the headache, pills for the GI tract, pills for the pain, pills for the numbness. And when you ask why, you are so broken, what do you hear? You're getting older. Then you look on YouTube and you see a grandfather doing more push-ups than you, a grandmother running a 5K. Why are they so robust and you so sickly? Genetics? We can't find the gene for tallness. If all our cells have the same DNA, why aren't we one giant blob of singular type of cell? Pain? You can't move around because of pain. But pain isn't a virus floating in the air like a cold bug. And old age is not a pathology. Injuries? Injuries? But why don't your injuries eventually leave? Your body refreshes every 7 years, all of your cells. If I switched out every part of a car, wouldn't the damage eventually leave? Wouldn't I have a brand new car? At the wedding, you are asked to dance with your niece. 5 years old, in her youthful exuberance, she kicks you in your toes. That hurt, but only to your toes. Now it is understandable for you to think that the whole of the body was not affected. So marvelous, the compensating method of your body, that you'd even notice that the whole of your body was altered. You know this instinctively, but didactically in school you were taught the different parts of the body are unrelated to each other. What does the status of my tires have to do with the AC unit of my car? Everything has a cause and effect, except for phenomenons. Phenomenons have no answer to why. They just are. Good news, the patterns of health are phenomenological. Your injuries are not. So how do I see the body? Just below the skin and wrapping itself around every organ and tissue of the body is a protein sheath of collagen and elastin called fascia. Think of the white of an orange that you peel. It is important that you know that the fascia does not change quickly, like a brook around a stream. The stream changes the brook over time. The way you move, the way you sit, the way you sleep, the way you live can change the fascia around every organ over time. Your bones are the next system. For simplicity's sake, the big ones move you, the small ones stabilize you. These muscles pull on bones. Bones are living and bendable tissue. Many respectable therapists think bones are soft tissue and label them as such. Bones can be twisted, they can wear out. It is a mistake to think that the frame of your body is like the frame of a car. Great Eric Dalton teaches muscles can tear the outer layer of the bones. When this happens, the body fills in the gap. Done enough times, you can get a bone spur. What happens when your 11-pound head falls forward from texting and becomes a 35, 45-pound head? Oh, something's wrong with my muscles in my neck. They're so stiff. They're betraying me. When you are in pain, your cortisol levels rise and your reasoning becomes compromised. This is why you should listen to my channel now and not when you're in pain. According to Jean-Pierre Barral, only after calcification are traditional methods able to find dysfunction within cartilage. Nerves run like cords all over the body. Nerves. Much hay has been made about their functionality, but not much attention has been paid to their mechanics beyond the spinal cord. These sensitive structures relay information, so the whole body will sacrifice much to keep your cords very safe. Nerves are extremely valuable, but it's still the rule of the arteries. Arteries are the greatest importance. They stretch, they bend, they are like the rest of soft tissue. They become dysfunctional. The dura mater, imagine a potato in a jar of water. Among many things, the nerves register pressure, and the spinal cord has its own weight. So if you were leaning on one side or the other, it would be registering that to your brain constantly. So this is the reason why your spinal cord and your brain are inside of fluid. For protection, yes, and to offset its own weight. So imagine an old World War II mind. On the shore it would pop. In the ocean, anchored down, it would go unexploded. The spinal cord and the dura mater are highly valuable tissues. The spine will twist the vertebrae and flex it laterally to keep the spinal cord and dura mater from ripping. My claim to fame in Jacksonville: organs. The viscera: liver, stomach, lungs, heart, kidney, spleen, the pancreas, all the organs below the belt. Everything gets stuck, everything pools, everything becomes dysfunctional. Your organs don't float around in space like they do in the anatomy books. Each organ is attached to other organs, to your spine and to your diaphragm by ligaments and fascia. Much like your muscles, dysfunction in your organs can occur when you move the wrong way, or don't move enough, or you sleep funny, or you took too many hits crossing the goal line, or you roughed house with your brothers. They can also become distorted by bloating. If something is making you bloat, go to a naturopath or a nutritionist or a dietitian to find that answer. I work mechanically. Organs can shorten the range of motion of your joints, your shoulders, your knees, and yes, your spine. Organs can cause spinal problems. But the problems don't stop there. Interestingly enough, you know this. The butterflies in your stomach, the heartache. Your organs feel emotions just like your brain. With G as a constant, heavy is the head, for gravity is always pushing down on the crown. Your brain wants to keep those eyes on the horizon, lest it lose its balance. The posture looks for the path of least resistance with gravity. This is why you don't see someone walking at a diagonal unless they're in incredible pain. Yes, posture is more than just that. Posture is emotional. I've never seen a truly depressed person standing up with their chest out, back straight. I've never seen a scared person standing, shoulders down. Posture is emotional. But how do we get that? The brain coordinates every ligament and every muscle for the right amount of laxity and tension, so we can stand up straight and we can walk through space. This is posture. We call all these small contractions in a line the line of tension, like a rope in an old Navy frigate. Just enough tension to catch the wind to the Barbary Coast, but not enough to get you stranded in the Atlantic. Unfortunately, most of you don't have a long mast sticking from stern to bow, like old Ironside. So the body has to get creative. These lines of tension go straight through the body: the feet, the legs, the pelvis, the organs, the spine, the heart, and the lungs, the neck, the jaw, all the way to the top of the head. All of this to keep your eyes on the horizon. So a knee problem that makes you favor one side can go straight through your body and cock your head ever so, forcing your neck muscles to change tension. And a neck problem can cause a long tension to go all the way down to your feet. Don't think this only goes one way up to the head. Taking tension out of a muscle is not hard, and it feels great. And you get a good tip for using your elbow in those deep tissue massages. But what happens if other therapists interrupt these lines of tension? Well, up the line of tension or down the lesional chain, everything becomes tighter, and that which was loosened becomes tighter because the pathology hasn't gone away. Oh well, I guess it's time for your next deep tissue massage. Please excuse my lack of tact. I know many of you, if you could go back in time, like myself, would, and tell ourselves the truth. Tell ourselves there's no shortcuts. I don't want to go negative. Napoleon Hill told me in his book about selling never to go negative, or you associate negativity with me. I don't want that. I want love and kindness and health, just like my fellow therapists want the same thing. But we need to break this pattern. I really enjoy my clients, but I don't want to see them again and again. And I don't want to sell you a punch card for your visits or a monthly membership to seeing me. I want to solve the problem. Lines of tension are not the only thing that runs through the body. Lesional chains as well. The body has to compensate around these lesional chains. I used the knee and the neck, but I could have used the organs. I could have used the pelvis. I could have used the head. I could have used the jawline. I could have used your shoulder. Many very, very good therapists don't even ask where the problem is. They see it as a distraction because the pain often is not even close to where the problem lies. Now, I think that's one step too far, but they are very good therapists and they get very good results. So, you understand, I don't start with pain. I look at tension. And therapists like myself and many others who are trained in visceral and cranial, sacral, and postural mechanics look at the body as a whole. Looking at the body as a whole is what inspired John Upledger to become an osteopath. Before teaching thousands of therapists cranial sacral therapy, Dr. John Upledger assisted on a surgery where the patient had a calcium plaque on his dural tube. Trying to hold the tube steady, the duromater pulled away from Dr. Upledger in a rhythmic motion. The rhythmic motion was not to the heart or to the breath. Going to Michigan State, he and his colleagues developed cranial sacral therapy, teaching therapists across America. He eventually left to Europe, where he met a certain French osteopath. In the early 1970s, the patient of a young physical therapist returned to his office for a follow-up. The patient's problem was solved, but it wasn't because of the therapist's doing. The patient went into the backwoods to get his organs moved. Dr. Jean-Pierre Barral worked at the Lung Disease Hospital in Grenoble, France, where he had access to cadavers and patients. He found lines of tension going through the organs. Jean-Pierre Barral earned his diploma from the European School of Osteopathy in Maidstone, Europe. When he was in school, there was no classes on visceral manipulation. He developed visceral manipulation in 1973 and came to the States in 1985 to teach. Visceral manipulation, or liquid osteopathy, moves organs for greater efficiency, freedom, and functionality. It is a direct technique. It is not hijacking the nervous system. It is not twisting another part of the body. It is not a lifestyle or dietary change. It is directly touching the organ, the associating ligaments, and the fascia itself. Let me ask you, if you had tight hamstrings, would you go to a doctor for a prescription or a surgeon to get them cut? A dietitian to change your diet? Or would you just stretch your hamstrings? My scope of practice is mechanical in nature. If you want pills or you want a surgeon to cut your hamstrings, I'm not the guy for you. If the greater omentum is tight, like your hamstring, then not only is your posture off, but the range of motion is off. Your functionality is off. When the structure is compromised, then the function of that structure is also compromised. Whatever it's attached to is also compromised, and in the case of the greater omentum, your stomach and small intestines are compromised. The liver is attached to your diaphragm by the falciform ligament. If it is pulled tight, what does that compromise? The diaphragm is attached to your breathing. The 500 functions of your liver. What happens to your posture? What happens to your spine? What happens to your sleep? One movement of my hand and the falciform ligament can loosen up. What happens to your breathing? What happens to your liver? What happens to your diaphragm? What happens to your sleep? Yes, I can work on the nervous system with MYK. Yes, I can work on the postural system with myoskeletal alignment. Yes, I can reset the tonus with a neural reset. And I can manipulate the facet and disc of the spine and the ligaments of the pelvis within range of motion. But what about the aorta? The artery, main artery that goes down your torso. At Chuck E. Cheese, you can get a Chinese finger handcuff. The tighter you pull, the smaller the hole gets. On the aorta, the hole is the lumen. When the lumen gets smaller, what happens to the blood flow? Does it get pushed back up to the heart? Does the heart beat harder? What happens to the blood flow to the rest of the organs below your belt? What happens to your breathing? What happens to your sleep? What happens to your hormones? Before you give me a bunch of money and ask me to have one of each procedure, let me explain to you how I do what I do. Understand straight lines don't exist in nature. Ratios, P&L charts, pie graphs, cause and effect is a Newtonian model of thinking. Cars, cannons, computing, bridges, buildings use Newtonian models. Half of our lives are run this way. My process is instinctual, potential, and mysterious. These are the phenomenal branch of epistemology. Reason, deduction, and proof provides variable Newtonian thinking, is excellent for paying the rent, keeping our streets clean, giving us MRIs, X-rays, ultrasounds, providing insurance, giving us nice clean laws in our courts, and other extremely useful things. But MRIs and X-rays and ultrasounds can't do what a good therapist can do with their hands. Listen to this quote. Aside from fractures and significant fluid extravasculation, which is visible on X-ray, all abnormalities involving muscles, tendons, connective tissues, joint capsule, synovial membranes, arteries, veins, and nerves are missed by this type of diagnostics. Ultrasound and MRIs permit us to view some soft tissue, but do not yield information changes on mobility, tone, motility, or functioning. Page 179, Trauma and Osteopathic Approach by Jean-Pierre Barral and Alain Corbier. You don't need to take these two men's word for it. Ask a lawyer how hard it is to prove soft tissue injury. I don't want this to escape your notice. If your therapist or practitioner relies on MRI, X-rays, or ultrasound, they are missing out on much soft tissue dysfunction. And if they can't detect a problem, how can they fix a problem? This is truly my goodwill to you, because nobody is supposed to be telling you this. Nobody's supposed to be telling you this. The implications of this is revolutionary. Furthermore, I don't know an insurance company that will take "just trust me" as proof to pay for that procedure or that therapy. And with the amount of regulation and insurance fraud, I don't blame them that they don't. So the people that have come to me most likely have exhausted the conventional Newtonian ways of solving problems. If you're coming to me, you've moved past Newtonian cause and effect and are on to phenomenological, quantum mechanical, praxeological solutions. How does a sommelier know what the grape was thinking when it was crushed and put into his wine glass? How do you know she was the one? How do you know that there's a one out there for everyone? How do you know God exists? The laws of physics at one time did not exist. Where did they come from? The laws of economics exist before anyone comprehended them. Where did they come from? How do you know good music, art, and movies from bad ones? You know because you know. Everything that motivates us, that inspires us, that pushes us is unobservable, phenomenological. Everything we want in and of itself is by logical deduction a mystery. Pain is unprovable. The question is why? Phenomenological problems demand phenomenological solutions. My hands can find tension. Your heart knows her when she opens her mouth. Your ears know the truth. How do you know good music, good art, good movies? By instinct. How do you make good music, good art, good movies? By instinct and being uncompromising. Art is uncompromising. The body lives between perfect health and death by degrees of compromise. So does freedom and slavery. Imagine now picking up your grandchild. Imagine going all day without a headache. Imagine sleeping deeper. Imagine getting off from work and wanting to party hard. Imagine not needing to go to surgery. Imagine not having to pay huge healthcare bills. More energy at the gym. Greater blood flow for intimacy. Men, what are we working for? One manipulation. One therapist. I can't tell you what will happen. No one can tell you what happened to Schrodinger's cat. I work in potential. Energy is potential. The future is potential. And I believe in a brighter future. One manipulation. One therapist. Come with me. Let us change the conversation from sickness to wholeness. To Jack's Wholeness. My name is Morgan, the Organ Mover McGee. If you're in Jacksonville, come find me. I have therapists on this channel. Find them. Thank you very much and God bless.